as general, there are two ways of doing the whitening. One is the take-home kit, and in the take-home kit is the one that we take a mold of your teeth and we make this tray, and we instruct you step by step how to use this tray at home with the gel inside it. The other method is the one that we do that in here on the chair, and with the one that we do that on the chair, because it's at least 2 hours of our time, usually it costs double, not because it's a better job or you get a better result, but because of our professional time that is being allocated to do the whitening. The in-house whitening or office whitening, we can use two different methods. One is referred as zoom whitening, which is an intensive blue light. This is not laser, it's intensive blue light. I emphasize on that. And that one usually causes a false chalky white result that's reversible after a couple of days. You still need to continue with the tray to get the ultimate result. The other one is with the laser. That's a real laser. We do it in here as well. And the only downside about the in-house or in-office whitening is it causes a lot of sensitivity because it really intense. We try to do that over 2 hours. Yes, you get a good result, but you need to continue with this one maybe once every couple months, just for half an hour or an hour to get to the ultimate result and maintain it. Maintenance with the whitening is important. People come and ask that, what if I do whitening once? Is that for the rest of my life? My teeth gonna be white? No. If you drink tea and coffee, red wine, anything that causes stain in your teeth, they get slightly yellow again. But by applying this tray only for once a month or once every couple months, based on consumption of different beverage that you've got in your lifestyle, we advise you will see the difference. You know when is the time to touch up.
We will take the shade using this shade guide to determine exactly what shade or closest to your original tooth colour is. We'll be checking this shade at your review appointment to see exactly how many shades you have progressed. So today we'll be issuing your whitening trays that we previously took the impression for. What we do is obviously we try the tray in first. We make sure that it fits correctly and that there's no sharp points around the margin of the actual tray. Then what we do is I'll go through with you and show you how to use the gel. We give you sufficient gel to last you the first 2 weeks till you reach your maximum results. We like to review you halfway through or towards the end to make sure that you are receiving the optimum results. So what you need to do, after trying in the tray, we grab one gel out of the packet. You slowly remove the cap and place the syringe tip into the slot and twist until it's engaged. Now you need to make sure that when you first use the syringe that you don't just shoot it. It's pressurized, which means that you could lose half the gel in one go. So you slowly put your finger over the tip and depress the syringe nice and gently, okay? Now, you only need a small amount of gel to put into each tooth. A lot of people we see load the tray up and it's just wastage. You don't need that much. All you need is a little bit in each tooth slot and just work your way around each tooth until you've gone through every single one. The molars at the back are not really a cause of concern. Nobody sees them, but if you'd like to put some gel in there, you may, but it's up to you. Now once you've placed the gel in, you need to pop the tray into your mouth and then you wipe off any excess. If you find that you have a lot of excess gel on your gums, you're putting too much into the tray, okay? So next time you go to do it, just remember to put a little bit less. Now, because we are using a hydrogen peroxide solution, you need to remember that it can irritate your gums. So as soon as you pop the tray in, use a wet tissue or cotton tip and wipe off any of the excess. During the whitening process, you may find that you do happen to get some sensitivity with your teeth, either to cold, hot, or when eating. There are ways in which to help combat this. One is using a sensitive toothpaste. Use it when you brush for the 2 weeks in which you are whitening. If you do find that you are getting more sensitivity, you can also use the sensitive toothpaste as a spot treatment. Afterwards, you just take a pea-sized amount of the toothpaste and rub it on your teeth and leave it there. Another option with the sensitive toothpaste is to, after doing the whitening, you can fill your tray with the toothpaste and sleep in the tray with the toothpaste in there. Another option is a calcium phosphate product in which we sell here, GC Tooth Mousse. It also helps combat that sensitivity whilst preventing cavities at the same time.